When did trusting the experts lead to disaster? My daughter went in to get a microdiscectomy, a lower back surgery that should have took 60 minutes and had her walking that same day, but it took 4 hours and left her paralyzed from the waist down. Her surgeon, Dr. Dingus, was adamant that everything went exactly as planned. She's just having a hard time dealing with it psychologically, as if a 60-minute nap was the thing that severed the nerves between her back and her legs. My wife and I pushed back on this immediately. This was supposed to be routine, my wife said, gripping Mackenzie's hand while I pointed out her inflated area around her lower back looked. Dingus barely glanced up from his notepad. Swelling is normal. Give it 48 hours. 48 hours turned into 2 weeks, and Mackenzie still couldn't walk or feel anything below her waist. We practically lived in that hospital, camping out in Dingus's waiting room until he'd see us. Each time he got more irritated, more dismissive. By week 3, he'd stopped examining Mackenzie entirely, just sat behind his massive desk, explaining how we were the problem. I've done 500 of these surgeries. Your daughter is experiencing conversion disorder. The mind can convince the body of anything, especially in adolescence. He was already writing a referral to psychiatry. Stop feeding her anxiety about physical causes. Mackenzie would wake up screaming that something sharp was stabbing her from inside. Dingus called it phantom pain. We begged for an MRI. He laughed and said he wouldn't enable our delusions with unnecessary imaging. The other doctors in that hospital would see Dingus's name on Mackenzie's chart and suddenly get very busy. One nurse pulled us aside and whispered that we should get a second opinion elsewhere, but when we asked her to put that in writing, she walked away. The week month was hell. Mackenzie tried to move her legs every morning, crying when they wouldn't respond. My wife and I took turns sleeping in Mackenzie's room because she'd wake up sobbing from the pain inside her spine. I remember we threatened to sue 1 month in. That finally got us an x-ray, even though Dingus marked it as not medically necessary, so insurance wouldn't cover it. $3,000 to prove what he already knew, he said. He made us wait while he reviewed it personally, and called us into his office with his smug little smile. Pristine, beautiful surgical work. No complications, no foreign objects, nothing abnormal. He held the x-ray up to the light like it was a trophy. Will you finally accept psychiatric help, or do I need to report you for medical neglect? I remember staring at the x-ray of my daughter's back, genuinely confused at how it really seemed in perfect health. I had no words for him, just stared at him while he shot back his cocky, I told you so smile. But despite her back being perfect, Mackenzie was still getting worse. She'd lost 20 pounds, couldn't sleep without pain medication Dingus grudgingly prescribed for psychological comfort. We did 2 weeks of psychiatry where the lady took notes on her mental delusions, while Mackenzie insisted something was wrong inside her. That's when my wife said we were done. We drove 3 hours to St. Mary's Hospital, different state, different system, no Dingus. The ER doctor was young, maybe 30. He took one look at Mackenzie's surgical site and immediately ordered an MRI. No questions about insurance, no lectures about psychological problems, just let's see what's going on. The MRI tech was chatting with Mackenzie about her favorite shows while positioning her. Normal stuff. Then she went quiet, staring at her screen. She excused herself and came back with the radiologist. They whispered and pointed at the monitor. The radiologist's face was serious when he asked us to step into his office. I need to show you something. He pulled up the MRI on his computer, turned the screen toward us. Even I could see it. This white metal thing against Mackenzie's spine, clear as day. This is a 3-inch surgical screw. It's been pressing against your daughter's spinal cord for 2 months. The tissue around it is inflamed and infected. My wife grabbed my hand so hard I thought she'd break it. Mackenzie started crying, but it was relief. Pure relief. I'm going to contact your original hospital immediately, he said. This needs to be addressed today. We sent everything to Dingus's hospital administration. Within an hour, the chief medical officer called us personally, asking us to come in immediately. The conference room had the CMO, legal counsel, Dingus, and us. Dingus sat there looking irritated, like we'd interrupted his golf game. The CMO slid the MRI across the table. Dingus glanced at it. This is obviously from somewhere else. Different machine, different imaging. They probably planted something to sue us. My wife stood up, shaking. You're accusing me of faking my daughter's x-ray, but the CMO raised his hand sympathetically. Dr. Dingus, look at this number. He pointed to something on the report. Dingus leaned forward. So, that's the serial number of the screw from our surgical inventory. From Mackenzie's surgery date. The CMO pulled out another paper. This is your signature, confirming you used this exact screw. Serial number F47829. Dingus's face changed. Not all at once, but like watching ice crack on a pond. But screws show up on x-rays, he said quietly. Not always. Depends on the angle, the type of x-ray, surrounding inflammation. You know this. The CMO's voice was deadly calm. You read the x-ray yourself instead of sending it to radiology. You told these parents their daughter was crazy when you left a screw inside her spine. Dingus was staring at the serial number. His hands started trembling. I always count my instruments. You missed one, but the x-ray was clean. I saw it myself. You saw what you wanted to see. Dingus looked at Mackenzie in her wheelchair for the first time in 2 months. He couldn't say a word to anyone in the room. He realized he had just been caught faking the fact he paralyzed our daughter. Full story on channel linked below.